Welcome to Tank Talk. I'm your host, Bob Tankard. And this evening's guests are from Brazil, except for Dr. Koehler. We have Dr. Gustavo Kesselring. We have Dr. Luis Augusta Russo. And then we have Dr. Koehler. Whew, that's hard to get out those names. Hey, listen, welcome to Tank Talk. I'm so glad you were able to come on. We're going to have a fun time. But the most important thing is to tell our audience why you're here, because the Vineyard audience is really concerned about Lyme disease. Doc, tell us a little bit about who you are.
Thanks, Doc. I'm Gustavo Kesselring, physician by training in Brazil. I live in Brazil.
Okay.
I'm very happy to be here to communicate to our Brazilian community the importance of the development of a new vaccine that is for Lyme disease. We know that Lyme disease is very endemic here in the island.
Yes.
And we are here to bring awareness to our Brazilian community about the importance of development of the new vaccine.
Good, good. Dr. Koehler.
Hi.
Hi, how you doing?
I'm excellent. I'm really happy to be here.
Good, good, good.
So I'm Dr. Kathleen Koehler. I'm at Vineyard Medical Care, and our clinic has been hosting Care Access and the Pfizer vaccine trial. And I'm also here to outreach to the community about the importance of the vaccine, and we have been happy to. We were the first place where the first trailers came in, but now the site is primarily down at the high school.
Exactly.
And so we're actively enrolling people now. So,
Dr. Russo.
Yes, it's nice to be here. Thanks for the invitation. It's a great pleasure to be in Martha's Vineyard. I'm leader investigator in Brazil of Care Access. Care Access is a company specialized in decentralized clinical trials. Their job is very important to bring to community the clinical research. Then we are arriving here with the possibility to test a new vaccine for Lyme disease that's endemic in the island. It's very important that people think about this disease and how we can prevent, and vaccination is so important for that.
Let me ask you something. The Care Access program is here on the Vineyard now. How will this program benefit the individuals or families on the Vineyard? How is it going to work? How will it benefit?
This is a vaccination program. So we are starting the clinical trial here in the island to understand.
When you say clinical trial, what's that? Tell me about that.
Okay, it's a kind of a research over the individuals that will volunteer to receive a vaccination program. They will receive a vaccination, and this vaccination looks for preventing this disease for the future. So we need to study the efficacy and the tolerability of this vaccine to understand better if it will work, and if it works, it will come to the market, it will come for the community and for everybody, not only for Brazilians, but for Americans, for everybody, to prevent this disease in the future.
So Dr. Koehler, this is just a trial basis. This is not the real deal, but it's on a trial basis with the vaccine. Okay, so are you asking for individuals to volunteer themselves?
yeah, we're asking people to volunteer for the trial, but also, as an aside, there is a remuneration for people who are enrolled in the trial.
Okay.
And I think that there's a $50 per vaccine. It's a series of 3 vaccines over the course of like a year and a half, and so there is remuneration up to something like $400 over a period of time. So it's not entirely pure volunteerism. So The clinical trial, it's a placebo
Okay.
clinical trial. 50% of people will get
Get
the
a
active
placebo,
vaccine.
right.
50% will get a placebo. But there is the ability at the end of the trial to have first dibs on, first opportunity to get the real vaccine if you got the placebo. It's an opportunity for people to be involved in actively in their own health care and to do something proactively. It's a way for the vineyard to be able to have access to the vaccine several years before the vaccine is going to be available nationally. And so that's one of the advantages of it.
Dr. Russo.
Yes,
has this been done in Brazil?
Yes, in the past in Brazil, and at this moment the clinical trial with this Pfizer vaccine is running only here in the United States.
Okay.
Because the prevalence of the disease is much bigger here than in Brazil.
Really?
Yes, much bigger here than Brazil, and also in Canada and some parts in Europe. And we're very worried with the pediatric population. I think the awareness came to children older than 5 years old to 15 teenagers and also adults and elderly population. This campaign is to everybody. And for children, we're very worried because the children, they can be ticked by the bug, that's a big bug, that causes the disease.
Let me ask you questions. United States has 50 states, and there are certain types of animals that roam from Maine to Alaska, from Alaska to Pacific down there, California, and then down to Florida, the different animals and those animals in the... What animal carries this disease the most?
Well, obviously, it's the deer, which we're being overrun
But is
with
it
here on the island.
is it the New England deer, the deer that's up here, the white-tailed deer, whatever they call, or is it the same type of deer out there in the Midwest and in California? And do they all carry? Is it all the same, Doctor?
Well, it seems that it's more related to the deer that you have here in the island. This is why it's so pandemic here.
Okay.
But probably we also have another deers that can carry, but it's less frequent that those that carry this bug here in the island. So this is why there are some specific areas around the world that we need to do the trials, because these are the endemic areas. So the endemic areas are those that have more the high prevalence of this disease.
Now, let me ask you a question. If the individuals that are part of the trial, and those that don't get the placebo, but those that are getting the real shot, you're looking for them, how would you test if they got it or they didn't get it over a period of, I don't know how many years you're testing?
Well, during the trial, there are multiple different ways that they're doing the testing, and it includes the standard Western blot that we all have access to, through the testing at the hospital. But there's also PCR testing, and to the point where if somebody develops a rash while they're on the trial, they have the ability to actually do biopsies and cultures.
And that would be
which is way more than is available, way more testing than is available in any commercial or even hospital setting.
But that would be the individual. If the individual that didn't get the placebo but got the regular shot, if they came up with the rash, what would that indicate?
If they came with the rash, you have to wait at least 4 weeks for the vaccination.
Okay.
It's the same if you have a severe case of the disease in the past, like myocarditis or any neurosystem disease, then this is an exclusion criteria to take the vaccine right now. Okay, but again, it's important that workers and people who work in the landscape here in the island came to the high school where Care Access has the facilities with a big lab, and have the opportunity to discuss with our staff the disease and, if possible, to participate in the trial.
I had Lyme 2 years ago. and I went to Dr. Koehler, and she cured me of it. She gave me the necessary medicines, the antibiotics, I'm assuming that's what does it, and cured me, right?
Yes.
Now I come to you and say, I want to be one of the people that go through the test. But I don't want the placebo, I want the real deal, okay? You give me the shot. What would it show up? Would it show up that I had the Lyme disease at one time, or would it not?
So if you are telling me that you don't want the placebo and you need the shot, since this is a clinical trial, placebo control, you will not be eligible to receive to receive any shot.
So I can't tell you anything. Exactly. I just got to let you give me the shot,
You
right?
get what we give you.
But what if you know who you gave the shot to, and the individual said, "Well, I had it before, but you give me whatever shot," and he comes up or she comes up with it? How would you give that person a shot? Would you let that person be a part of the test?
Yes.
If they had Lyme disease a couple of years ago?
Yes.
You would?
Yep.
Yes, but this is a double-blind, placebo, randomized control. Then we even us, we don't know who is taking placebo because we don't want to bias in the research.
Okay.
Okay. After 1 year, 1 year and a half, it's going to happen on open label, and people who were in the placebo arm, they're going to receive the vaccine.
Now,
and the vaccination should be to everybody in the end of the trial.
At the end, and the trial goes for how many years? 2 or 3? Is it?
I think it's a little open-ended at this point. How we know that there's going to be at least 2 shots, probably a third booster. Now we all get the idea of vaccines and boosters, and so at the end of, it's going to be anywhere from 1.5 years to 3 years. But to get back to your questions about the testing that's available through this study is much more extensive than anything you can get anywhere else, and it's almost worth the price of admission just to be able to get that kind of testing. You can have had Lyme disease before. You can have had it multiple times before, just not within the last 3 months. And that's one of the exclusion criteria. You can't have had a recent tick bite. Now that's probably one of the trickiest pieces of it, not having a recent tick bite on.
Because maybe some of your clients, some of the individuals that are going to volunteer to come and participate, might have had one and don't know it.
Correct, and that's just that we were talking about that. That's just going to be one of the issues we'll have to deal with as part of the trial.
Now, let me ask you a question. You know, when a person says,
most people don't.
Well, no, right. You know, the tick is so small.
Exactly.
You know, I was talking to a woman yesterday, and she was saying, you know, about the ticks, and I said, you know, she says, you know, I like to go up into the woods. I live in the woods. I like to walk through the trails and stuff. I said, listen, you have to come home every day. You go through those trails, and you have to dress down and either take a shower or get yourself a fine to make sure that you don't have anything on you. I said, that's the only thing you got to do to your kids and your grandkids. What does a person have to do to be a part of the program? How do you get the message out to them other than Tank Talk? How do you get them out? How do you get the message out to come and be a part of the Care Access program?
We are
without them having fear, because you know, and saying, you know, we had the COVID and everybody didn't want to take COVID and blah blah blah. Now another needle, another thing going into my body. How do you get them over that hump to be able to say, I want to participate in the program?
So this is a part of our mission, that we are here to bring this awareness for us, for the Brazilian community, and to address this problem through TV, newspaper, gazette, to the church communities, for the Brazilian communities, and going to several people that understand better the Brazilian community, to spread the word for their families and for their community.
Now, is this just for the Brazilian community or for anybody?
It's for everybody.
Okay, now, the pastor of my church, and I go to a church that also participates. The Brazilian church goes there also, you know, and Pastor Renata. I know he has talked to his congregation. Do you expect more Brazilians to participate in the program, or just people in general?
We think that people in general, but of course you are here two investigators, two Brazilian investigators to speak in English and in Portuguese, how important it is to be volunteer for this campaign of vaccination. The number one motivation for a volunteer to participate in a clinical trial is for altruism, for the future of the population, for the future of humanity. That's now we are surpassing the tragedy of this pandemic, COVID pandemic, and you are not using masks right now, exactly because you took the vaccines. That's the same for Lyme disease. This is number one motivation. And number two motivation is to know more about Lyme disease. You made few questions, many questions about that, many doubts. How can I get the disease? How can you protect against the bug, etc., etc. Then it's important to know more about the disease. And this is a great opportunity in the clinical trial.
You know, one of the things is that everybody's talked about it for years. You know, we've always known that we had this disease on the vineyard. And as the deer population grew, and as it begun to, you sort of have a limitation on where you can hunt, so you don't get as many deer as you used to get and whatnot, individuals want to know that if I get this, if it works, will I ever get Lyme disease again? If I get bitten by a tick after I take the shot, and the shot's working, and will I get the Lyme disease? Will I get it? It's like the flu shot. I can take a flu shot, and I might not get it this year, but if I don't take the flu shot next year, I might get it. How is that? Is that the same thing with the Lyme?
Well, we don't know.
We don't know yet.
Yes.
And I think that we're all a lot more comfortable with the idea that we need boosters, whether or not you need a booster tetanus shot every 10 years.
Right.
We're finding that we need boosters for measles, mumps, and rubella. And COVID and the flu vaccine have really shown the fact that that we need boosters. You know, if you go back to the vaccine that was here 40 years ago, the vaccine that was on the island. Now that's a 40-year-old vaccine
for Lyme disease.
For Lyme disease.
Was it really? I never knew that.
Right, it was in the 90s.
Wow.
And there were problems with the vaccines, but it was actually fairly effective, and that was 40 years ago. I think my confidence that this is going to be an effective vaccine is pretty high. We've also it's not, you know, there's a lot of COVID vaccine fatigue.
Right.
You were mentioning that. I mean, so many people are just like, they have this attitude, I'm just so done with vaccines and boosters, and that's making our job harder now, is that. But the flip side of it is, here in our little clinic, we see a lot of the urgent care on the island at Vineyard Medical Care.
Right.
In the summertime, it's just like half of our patients. And I would say, of the people coming in this summer thinking that they had COVID, half of them did not have COVID. They had Lyme disease. They come in going, I've got COVID, I've got a fever, I feel terrible, and it's Lyme disease. And COVID distracted us from the specter of Lyme disease on the island. Long before there was long COVID, we had chronic Lyme disease.
Let me ask you this, all of you. On the island, we look at Down Island, which is more residential. We're talking about Oak Bluffs, Vineyard Haven, and Edgartown. Okay? Now, each of those towns have their wooded areas. Okay, but we're not the same as West Tisbury, or Quina, or Chilmar. Do you find that the people living in those areas are more susceptible to getting the Lyme than those individuals Dr. Koehler, you probably be able to answer that one.
Well, yeah,
Than the ones down island.
Well, that's true. People who live up island in Chilmark or in Chappie, it's Chilmark, Aquinnah, and Chappaquiddick where the most of the Lyme disease and the other tick-borne diseases are. But it's more the career, whether we're talking about landscapers or construction workers or people with pets. You mentioned children. We were joking about this yesterday. It's 8-year-old boys who go out and roll in the weeds
all the time.
And
that's part of their DNA.
And my 2 boys had Lyme disease when they were kids, just for that. It's almost less where you live and more what you do. And another thing I wanted to put out there too is a lot of the African American population on the island thinks of themselves as being somehow, because I've heard this from my patients, somehow that they're not as susceptible. And I just want to put this out that we're all equally susceptible to it, but more importantly, when darkly pigmented, when black people get Lyme disease, it tends to be more advanced. This is well documented in clinical studies.
Because it doesn't show up as quick?
Well, it's easier to miss a dark tick on dark skin, and so people aren't looking for it. The individual isn't looking for it. And then when you get the bullseye can be really subtle on black skin. It's really easy to miss. And so that's our second. Your first warning symptom is you got the tick bite. The second one is you get the bullseye. But then the third manifestation are the things like Bell's palsy, facial paralysis, and heart, and that's much more common. Advanced disease is much more common in blacks.
How close are we to having this come to reality? How close are we?
What? To what?
To get the shot. I'm talking about
right now.
I'm talking, but you're still doing a test right now.
Exactly.
But how close are we to say that you can go to the doctor, and when you get your annual physical, you can say you want the shot?
I think that we're very close. This is a phase 3 study. We have an important program from Pfizer. This is a Pfizer vaccine, high technology. And in the Brazilian national program of vaccination, we have a very strong project that started in the 70s and in the end of the 70s. And Dr. Sabin, that was the person that discovered the polio vaccine, came to our government, and we start a very strong program in the country. And I think this is important. There are a lot of fake news about vaccines, but vaccines are very, very important and a strong way to prevent disease.
Now, it's the same.
We're in the phase 3. Then you are going to have this vaccine in 1 year ahead to the entire population. 1 year and a half.
Now, you said that this disease is prevalent in Canada also?
Yes.
Why is it
in parts of Europe too?
In parts of Europe, but why is it not in Brazil, Brazil is about as big as the United States, or bigger?
We have in some areas in the landscape, but it's under control. We had some epidemic in some areas with endemic Lyme disease, where we have cattle. But at this moment we don't have like here. You have 500,000 inhabitants got Lyme disease in the United States and Canada in the last 5 years.
Wow. Is it because, does the Lyme disease follow a certain demographic area? If the area is alike, in other words, if Martha's Vineyard, if you had an area like Martha's Vineyard, same climate and everything else in Brazil, would that be a nesting place for the Lyme disease? If it was like the same place in Canada or a place in Europe, does a climatic factor have to be sort of the same for it to nest and to become?
And the animal that transmits the bug, you need to have the same kind of animal in the same place. So there are several conditions, geographic and animal conditions, that can deliver can increase the prevalence of the disease. So how could I say, the preferable conditions are here.
You got it right.
In the northeast part of the U.S., in Canada, and some parts of Europe. But these they have a similar geographic and animal conditions in the same place.
Where do we go from here? Where do we go from here? You know, you're talking, bringing people together.
Bobby, I think that people is living more. They are achieving ages like never thought before, 90s, 100 years old, because they are using new drugs, new medicines, new vaccines, because of clinical research, because of our jobs here as a doctor, as investigators. That's why we're living more. We have a better quality of life, and Care Access is bringing to the island an important program, and we are very thankful to you to spread news about this vaccination campaign, because this is very important, not only for United States, it's for humanity. To have a new vaccine for Lyme disease, this will be important in all over the world.
Well, one thing, it's here on the vineyard. We don't restrict our kids, our young kids, from traveling to their friends' houses, wherever they may be. And many times we're so busy sometimes that mom and dad or big brother or big sister don't have the time to go through that child when they're coming from a certain place that we know that, it could be different. So I think that country is ready. Even though we've had an infestation of COVID and everybody's taken the COVID shot 5 or 6 times, I think they're ready, because if nothing else, the vineyard has been dealing with Lyme disease for 100 years, and there's something that to detect it sometimes people don't understand, like you were saying, African American people or people of a certain color can't detect it all the time, or even people wait until something major happens in their in their system. How long? I know you're testing now, I know the placebo, but how many more years before we can get something on the market?
Bob, you have seen with COVID. It was a shot to the moon. The clinical research for vaccines that previous to COVID took 10 years. We were able to develop an efficacious vaccine in just 1 year. So we are in a phase 3 clinical trial. Probably in 2 years, if the results are good, they will commercialize, they put this vaccine on the market, and probably, if it works, Vineyard will be the first place that will receive the vaccine, because they have participated.
Can I hold you to that? Can I hold you to that? That the vineyard will be the first place?
No. You know why? Because you are part of the trial. And under the rules of the clinical trial, the participants of the clinical trial are allowed to receive first their vaccines.
So it'll probably be, I'm going to guess that in 3 years it'll be nationally available, but it's available right now in real time. We've already got 300 or 400 people who are already enrolled in the trial.
Really?
And
from the island?
Yes.
Wow.
So,
great.
but we have a long way to go. And
well, how many are you looking for?
well, Joe, how many are we looking for?
800.
800?
800.
800.
And so,
Yes,
so
800,
we're.
1,000.
But time is of the essence too. Lyme disease, as we all know, is mostly a seasonal disease, and we want to get people in right now, because especially with landscapers going out and doing.
And they'll be out until the 1st of January, because they got the leaves and everything else to pick up.
Right.
So they'll be right there infested with all that stuff.
And we used to think of Lyme disease really as only something that was in the summertime, but fall is a big time, just like you said. But with global warming and in the last couple of years, we've been seeing in the clinic, we've been seeing bullseyes in January and February. We barely have a frost. And so it's turning into the potential to turn into a year-round disease.
And we're supposed to have a mild fall this year. Listen, we got about a minute, okay? And
Okay.
tell the audience something that you want them to hear.
Yes, I think that's
Look right
very
there.
important. That's very important for the parents and the teachers and the school to discuss this important prevention campaign, because Lyme disease is a severe disease. You have kids, you have grandkids, and sometimes you don't know if they had a tick in their arms or in a place in the body that you cannot perceive. Then it's very important that people understand that for the good of the population, VNR population, the Brazilians and the Americans who lives here, to participate and come to the high school where Care Access came, and we have a lab, we have a staff that is prepared to take care of you. And you're going to learn much more about Lyme disease and to have the opportunity to participate in the clinical trial phase 3 with a Pfizer vaccine. This is very important to you.
Thank you. Listen, I want to thank the three of you for coming on Tank Talk. You have an open invitation, and Dr. Koehler knows where I live, so I can't run from her, okay? But you have an open invitation anytime. And if I find out that you didn't call me, I'm coming to get you, all right? Okay. So I want to thank you guys, and I wish you well with your experiment. And I want to thank you for tuning in to Tank Talk. Till next time, this is your host, Bob Tankard, saying good evening.